The modern world doesn't acknowledge, but in our time, many yearn to break free of a prison of flat secular materialism. Wait, wrong podcast. But if you aren't already listening to Lord of Spirits, you definitely should be. The modern health paradigm is just as beholden, though, to materialism. We're constantly bombarded with wellness trends, diet fads, and self-optimization strategies, but very few consider health through the lens of Orthodox Christianity. This podcast is here to change that. We'll dive into topics like fasting, prayer, stress, nutrition, and even physical training, all while staying rooted in the timeless wisdom of the Church.
Each episode will break down key health topics from an Orthodox perspective, bringing in guests, whether they're priests, health professionals, or experts in traditional wisdom, to help us navigate the practical and spiritual aspects of true well-being.
Welcome to Orthodox Health, the podcast where we explore the intersection of Orthodox Christianity, physical health, mental well-being, and spiritual growth. I'm Dr. Michael Christian, joined by my co-host John, and we're excited to take this journey with you. So grab a cup of coffee, lots of cream, coconut for fasting, and let's get started.
Blessed is the man who walks not in the counsel of the wicked. Alleluia, alleluia, alleluia. For the Lord knows the way of the righteous, but the way of the wicked will perish. Alleluia, alleluia, alleluia.
Welcome back to the Orthodox Health Podcast. I'm your host, Dr. Michael Christian.
And I'm John, your co-host. We're glad to have you back with us.
Absolutely. And over the last few episodes, we've taken a deep dive into what it means to be a man in today's world, both physically and spiritually. From testosterone decline and strength training to self-mastery and sacrificial leadership, our men's health arc tried to cut through the noise of the confused culture and recover something that is rooted and real.
And we wrapped that up with our good friend Jeff Messina, a fourth-degree Brazilian Jiu-Jitsu black belt and newly illumined Orthodox Christian. That conversation really brought together themes of discipline, humility, and embodiment. If you haven't listened to that one yet, it's definitely well worth your time.
That's right. But we've always known that we couldn't just stop there. Because if we're going to be talking about healing the body, rebuilding the home, and restoring the church, we need to turn toward women's health too. And we've explored that before once with our good friend, Orthodox Christian midwife, Brennan Straka, who, like I said, was also my wife's godmother. So we got lucky there. And she helped us talk a little bit about fertility, femininity in a world that tries to undermine both.
Exactly. And today we're excited to officially launch our new arc, one that looks at the feminine body, mind, and soul through an Orthodox lens. We'll be hearing from mothers, health experts, and cultural commentators over the next few episodes.
That's right. And we're kicking things off with a perfect guest to set the tone. Katherine Phillips is the host of the Faithful Flourish Podcast, and she has a background in public health and is a health insurance broker in her day-to-day life. But she brings a rare blend of clarity and conviction when it comes to women's health, flourishing, and the role of the church in all of it.
Absolutely. She's interviewed several of our upcoming guests already, such as Gwen Hoffmaster and Presbyter Marina Thornburg, and she has a powerful perspective on what it means to be a woman of faith in a medicalized, performance-driven world.
Absolutely. Now, this episode is going to set the foundation for the rest of this arc. And we're talking about access to care, prevention versus pathology, liturgical rhythms, and what the church can offer that the health system can't always. All right. So, Katherine, welcome. Thank you for joining us. How are you doing today?
I'm doing well. Thank you for having me, and I'm excited to be the one to kick off your series. It sounds like a very interesting series, so I look forward to hearing the other guests that you have. And Presbyterian Marina and Gwen were amazing guests, so I think you'll find they'll offer you some great insight.
Beautiful. Yeah, we touched on at the end of the last episode.
We're very excited to speak with the both of them.
Yeah, a situation where we're trying to explore the whole gamut, and we talked about this at the end of the last episode that obviously we're men. We don't have that same experience, so we wanted to bring in experts for the entirety of this arc. And with your show, I think you launched right about the same time we did. So we kind of had been on a parallel trajectory.
Yes.
And yeah, our first episode launched on the beginning of Lent, on the Monday of Lent this year, the first day. And my wife encountered your podcast shortly thereafter, and she became a pretty big fan pretty quick. I was like, oh, I got to check her out, and definitely like what we saw. And so definitely wanted to have you on at some point. So the question we always ask to start the show whenever we have a guest is, I know you're cradle Orthodox. What I like to know is, in what ways do you see your Orthodoxy paralleling with health in general? When it's a convert, I usually like to see how that journey progressed, how you actually got there. But the biggest one is to start what's the biggest overlaps you see in Orthodoxy and in health? Name of the show.
Wow, that's a loaded question.
It
I
is.
honestly have never thought about it before until I encountered your show, and of course, until I worked in the health field or got interested in public health. But I think the way Orthodoxy or just religion in general relates to your health is how your spiritual health relates. Because in my experience, once your spiritual health is out of line, then your physical health is out of line, your mental health is out of line, your relationships are out of line. So you kind of are not in this balance, and you're not able to live a balanced, healthy life that you are striving to live. And we are called to live our faith every day. And when you are not feeling like you are in control because your health is out of whack, then I think that is when things can kind of go awry. So I think in my experience growing up in the church, it's all about using those seasons of your life. We're all going to have a season of things change in our life. We're going to get busy. We're going to get sick. We're going to have things happen to us, but we come back to the church. And that's what's really important, and focus on our spiritual health when we need it the most.
Yeah, absolutely. I'm going to pull from the title of your podcast. I suppose that would be what you consider flourishing, is when your body, mind, soul are all in this harmony, and that you're sort of in sync with the rhythms of the church, and that even when your life sort of takes a tangent and goes on a trajectory you didn't expect, you're able to come back to Mother Church, and she'll sort of help realign things for you, and just living through all of that in Christ.
Yeah, absolutely. I mean, there's been times in my life, like I've had some health problems. I've had some times when I was having imbalance in my life. Like I'd struggled with having too much focus on work instead of living that balanced, soft life that's kind of feminine, like I've talked about on my podcast. But when you're out of balance and when you are living a life that's not kind of centered, like your faith is centered in it, you're really going to notice it. Like you really do. And it becomes apparent. And the way to get back to that is really just making God the center of your life and making it a priority to have your faith part of your daily life.
Beautiful. And so I'm going to throw you a curveball. We normally don't get into heavier topics early, but I just remembered that when we were doing our yoga and weird new age stuff, you actually happened to be posting an episode at the same time on that. So we're talking balance. And yoga is all about balance and and stability. We usually reserve this question for the priests, but what's your stance on yoga and other Eastern and New Age practices?
So obviously I'm not an expert, I'm not a priest, but from what I researched, and I did a whole episode about yoga and superstitions and things like that. And the reason why Orthodox Christians just don't really believe in yoga or superstitions or luck is because you're taking away your focus from God. That's put simply. And when you're doing these yoga poses, for example, and you're doing them in such a way that's making you be mindful, it's essentially having worship toward Hindu gods. And that's the research that I had found. Now, I have done yoga in the past. Like, I'll say I've done it. I'm not going to say I've never done it. Well, I feel like as Orthodox Christians, as we go on our journey, even with our health, we do things that we used to think were really healthy, whether it's for our physical health or spiritual health. We think it's really healthy, and then we discover maybe this wasn't as good as it should have been, and then you move on and don't do that anymore. When I used to do yoga, I didn't do it as like I'm worshiping whatever. It was more just like for exercise, so I never took it too seriously. But when you look more into it and see that it's kind of something that's not really what we should be doing, and you can replace it with Pilates, bar, weightlifting, cardio. There's so many other things you can do. Then that's something that you should consider and maybe look into it some more. Ask your priest, see if that's really going to affect your spiritual health. And I got my Orthodoxy and the Religion of the Future by Father Seraphim Rose. In that book, he talks about yoga, and that was his stance. So that's where I got my
Yeah.
information from. So I'm by no means an expert, but that was my understanding of it. And I'm sure you've talked about it more on your podcast and have interviewed priests about it. But I think at the end of the day, whatever exercise we're doing, whatever health regimen we're doing, it's all personal. So, and I always talk about not judging others. You can't judge others if that's what they're doing. Like, good for them. That's what they're doing. We can't judge them. But at the same time, we do have to do our due diligence and look into things and make our own opinions and see if it really is hurtful or beneficial to our spiritual and physical health.
You're absolutely right. And our position in most of all our conversations about this topic has been what you said, that there's so many alternatives. There's a lot of different options for your physical fitness, that there's essentially no reason to be doing yoga or any exercise program that has spiritual baggage that's not associated with Orthodoxy or Christ when you have these other options. That's sort of been our position, is that why choose the one choice that's associated with demon worship when you don't have to?
Right. And that was basically what I was going to say is our general stance is we're not blaming Susan the yogi at the strip mall. And if you've done it in the past, we're not saying that you're damned and you're going to hell. And whatever you're doing right now, we're here to say, like, just like you said, of, hey, maybe don't do that. There's a lot of reasons why not. There's so many better options. Let's go with that. And it just reminded me when you were talking about balance that we happened to be on that same arc at that time. I was like, hey, now that I got you here, let's throw it out there. So moving away from that, let's get into a little bit about your public health work. You have a background in education in public health. What do you think is the biggest problem we're facing right now in the current medical system?
From a public policy perspective, because we haven't had anybody from that yet.
Yeah, so my background's in health education. I went to school for public health and health education, but currently I work in health insurance. So I see on a daily basis access to healthcare. And I think that's one of the biggest things in our future is how are people accessing healthcare? Are they doing it affordably? Are they getting it in a timely manner? Are they able to get health care based on rules and regulations, because there are a lot of rules and regulations in the United States that many people don't know about. And there's also limitations. A lot of people get insurance through their workplace, and that's what they rely on. They rely on a job. Well, what if you're unemployed and you can't have health care? So I think for me, working in that health policy space is really eye-opening, because when I first went to school, I thought I'd do health marketing and things. But now that I've been working in insurance, I've been seeing that the people and their access to health care and the things that they go through on a daily basis, trying to get medications, trying to make their bills and try to pay for their health insurance premium, try to make ends meet, that's really something that we should be caring about. And unfortunately, it's not talked about enough, I think. And if it is, it's hidden in the media. People don't really see it. And I go through it every day I talk to people, and a lot of times it's heartbreaking.
Yeah, I mean, that's definitely considered one of the single most financially devastating things, is having a major medical expense that ends up just destroying everything you've built your whole life towards. Oh yeah, it's definitely a very major issue. And from a Christian perspective, particularly an Orthodox Christian perspective, right? Hospitals were started by St. Basil of Basilicas. And for us, that's something that's a major part, the charity aspect. It's an area where I feel systemically we are failing, both as a society, but as Christians. And it's a system where, obviously, I'm going to have you speak to it again a little more because that's more your forte. But from my perspective, the way we deliver care, but then the way we incentivize that care to that insurance model where people aren't able to afford care that they should be able to get. And I think that as Christians, we should be building more towards something where we can provide that care.
Yeah, like financial devastation. The number one cause of bankruptcy is medical debt, medical bills. So obviously, if you have all these medical bills and you are sick and you take all these prescriptions, the medical system in the United States, specifically, if you're a listener like outside the US, this doesn't really apply to you, but it could be educational for you. But in the United States specifically, it is very unaffordable for people because we have our health insurance policies that are going to help you in case you get a really big bill. But before that, you have to pay what's called a deductible, which is the amount you pay before insurance will start paying. And these are $9, $10, $15,000. So on top of your monthly premiums, now you're paying that deductible and you're in the hospital and you have day-to-day bills. So it just snowballs and it adds up, and you can see why people really struggle. And you're right, it's a departure. If we think of hospitals that were started by the church, for example, you had nuns who were helping out and they would just care for people. That's what they did. You know, they wanted to care for people, and it wasn't about insurance. They weren't asking for money. It was generally to care for people. So now it's more of a business, unfortunately. I think we've gone from generally caring to it's really, we want your money.
That was going to be my next question, was that to what degree do you see that it's a profit-driven model, that it could cost less, but the way that it's set up, it's oriented towards profit. We're trying to make money off of people's suffering.
It's 100% a profit-driven model. At the end of the day, healthcare in the United States especially is a business. Every health insurance premium that they're going to get from you is for the benefit of the insurance company. Any bills that they want to bill you, a lot of times they bill things that aren't even necessary. They want to do tests or things that aren't necessary. There's instances where on these health insurance plans, you must stay in network and see specific doctors. So you're paying for this expensive plan and you can't even see all the doctors available. You have to see certain doctors. So if that doctor's at a network, you're in an emergency, you have no say what hospital or doctor they're taking you to. Suddenly you're out of network, insurance won't cover it. Now you're stuck with the full bill. I have seen situations where people, they have insurance and then they still get a huge bill because they weren't part of the system. They weren't in network. They didn't have a specific test done or things didn't align like the insurance is supposed to. So at the end of the day, it is profit. And I see that every day. And I do the best for my clients to try to make them understand this is how you can use your plan to make sure that doesn't happen to you. But at the end of the day, it can still happen because it's all about profit.
Yeah, and you had mentioned about things not being properly filed. My wife actually went to school for medical billing and coding, and yeah, it means, we need to have this test in order to get that test in order to do this one, and then maybe we'll actually process the claim. It's wild, and I know how many times. So depending on what state you're in, I can order your blood work for you. I mean, a lot of them at this point, you can do self-service blood work where you just put in the requisition yourself and you go get it. Otherwise, New York, unfortunately, is one of them, New Jersey, depending on which lab, Rhode Island or Connecticut. It's usually those four that are the squirreliest for me. And in terms of that, when I'm working with somebody in those states and they have to go through their primary physician to get their blood work, it's wild how much pushback they get, because I know the reason isn't necessarily the doctor doesn't want to do it, it's that their hands are tied by that red tape, by that, no, I need to have a reason for why I'm doing this that's documented, and I need to have like 3 other tests in order to be able to test the one blood marker that I'm looking for. And it's just the wildest thing.
Yeah. And I see that a lot with Medicare. I work with, it's over the over 65 program that's government based. I see that a lot with Medicare. They do a lot of prior authorizations, especially if you have a very specialty medication. They do things that they want to make sure that the way you utilize care, especially if you're on the Medicare Advantage plans, which have your expenses paid through by an insurance company, they want to make sure the way you utilize care is going to be the cheapest possible for the insurance company. So they're not going to necessarily approve everything. They want to make sure things are actually going to be used. So I think in my experience, I've been doing it for 6 years, and every year it just gets more and more. Like the deductibles get higher, the rules and regulations get more strict, and I just see things. I mean, I can tell stories. This isn't like an insurance podcast, but I have had instances where things really have not worked out in people's favor, and it's just very heartbreaking that they need this care and they can't afford it or they can't get it because of the system and the red tape. They purposely just want people to pay out of pocket instead of having it covered. It's just sick care. They just want you to pay for the health care and not benefit you.
Not actually be healthy.
Yeah, exactly. Not healthy, and working in public health and having a public health background. That's why I liked it so much and why I went to school for it is I liked the whole preventative care type side of it. Because
Absolutely.
with public health compared to a doctor, being a doctor, it's preventative. You're taking care of your health before you get sick. And that's what really drew me to it because I really wanted to help educate people about how to take care of their health. I loved learning about like environmental health, global health, health policy. So it just was such a great, learning program for me. And I just kind of fell into insurance. I didn't go to school for insurance. I just kind of found it because at the time when I graduated in 2019, there were no public health jobs out there. And now there are because COVID hit. So now there's so many opportunities.
I'm going to say, by 2020, there was probably plenty of jobs for public policy, for public health.
So there were plenty of public health jobs. Pick a hospital, a health department, whatever. But at that time, I was okay, I'll try this insurance job. I found the posting, kind of just went and saw what it was about, got my license, got a pretty good client base. And then COVID hit. So I had the choice. Do I want to go into the public health space and help in the efforts? Or do I just want to stay, work from home, build my business, help the people who've lost insurance? So I did that. I stayed, worked from home, helped the people who lost insurance, and then my business grew from there. I think at the end of the day, things work out how they're supposed to. Like God calls you in a certain way, like you're supposed to go, even at first you don't think it. I didn't like insurance when I first started. I thought it was boring. It's sales. You had no sales experience. I had no idea like how to make a phone call. I was scared to make a phone call.
And now you have a podcast.
Yeah, now I have my podcast, and then I have over 700 clients. We're in 12 states. So we've just grown so much. And if you just don't take that leap and take that calling and kind of get out of that mode of, oh, I thought I was going to do this and it only has to be this path. Well, what if you are called to a different path and you are putting your blinders on basically and you can't see it? You can't see the opportunity in front of you. So I had to kind of realize that. And luckily I had people around me who helped me realize that. But it did take a lot of self-reflection before I really was able to commit to my business.
So I'm just thinking back. We'd started talking about how all of the hospitals were started by the church and that they had monastics basically providing this care out of the goodness of their heart, that we're doing this for love of our brother and sister in Christ. And now it's become privatized, and I don't know how much of that has to do with, I would venture to say it probably has a lot to do with the sort of breakup and degradation of Christendom. So that when the church lost its sort of, what would you say?
When usury was allowed.
Well, church being the center of civilization, essentially, that things revolve and orient themselves around and towards the church and towards Christ. And when that gets dislodged from the heart of people, something has to take its place, and you end up with this. You end up with the greedy sick care model. You end up with what we have now. And I mean, is it even possible to have the church step in and take a bigger role in this like it used to? Is this going to take 100 years to re-evangelize the world, to, make the church powerful enough to be able to handle that type of workload? What can be done is what I'm thinking. How do we not even go back, but in our modern time, how can we bring the spirit of what started healthcare back into it? What do we do?
Well, I think as you were talking, I kind of thought of something. So I think what we can do, just as Christians, because this is an Orthodox Christian podcast, Christians are listening. As Christians, what we can do is we can kind of move on to that preventative side of things. We can prevent ourselves from having a giant hospital bill by making sure we're healthy, eat right, get enough sleep, drink enough water, exercise regularly. We're healthy so we don't have to, God willing, get a huge hospital bill or keep going to the doctor, take a lot of medications. And that's how we can kind of get back to it, where we are taking care of the body that God gave us and we are able to used the healthcare and honored the advances of medicine, because that's also something that God gave us, advances in the world moving on. But we're also able to kind of preserve the traditions of, hey, I'm only going to go to the doctor if I'm literally like super sick. I'm not going to go for every little thing, and I'm going to use my daily life to prevent getting sicker. That's kind of where the public health plays in. And that's why I like public health so much. Why I think, going back to your first question about how being Orthodox and spiritual health intertwines, I think that's how we as Orthodox Christians can intertwine our spiritual health with our physical health, is be sure to be healthy, basically, on a day-to-day basis. Take care of your health. Make it a priority for yourself to not have to use insurance and have these huge bills. And that's how you can get back to that.
Absolutely. And that's beautiful. That's exactly, though, why we always ask that question as our first question is, especially for the cradles, how does it incorporate in your life? Because there's aspects of it where it's just so ingrained because you grew up in it that you don't necessarily think about it. Whereas for us converts, coming from a Western mindset, a very legalistic understanding of Christianity, once we started to learn that the church is a hospital for the souls, there's that medicinal understanding. So it's baked into the cake for us how important that medicinal understanding is. So for me, particularly coming from a preventative and alternative and integrative model of health, lifestyle factors are a huge thing. And so for me, that was just, this all ties together, that if we can heal body, soul, and spirit all in the same time, that's what we're here for. And so to that point, the preventative end is exactly it. And while the Bible and church tradition are not science textbooks, there's so much wisdom to be gleaned from them through the practices that the church has laid out. And that's a large fat part of what we're trying to do here, right? Is pointing out that, hey, this fasting is going to help you here. This prayer is going to help you here. It's going to help body and mind, and consequentially, your spirit, your soul, because you are not distinct beings. Each of those, while we compartmentalize them, we reduce them in the modern understanding, they're all the same thing. Your body is your soul, is your spirit. It's all part of the same process. And an issue in any one of those is going to have downstream effects in the rest of you. And real quick, it came to my thought, it was Psalm 54, usury and deceit have not departed from her streets, right? So that's what I was saying before about when did it happen? When did we fall apart in terms of not caring for our brothers? That's it. It's Psalm 54.
Yeah, I mean, hey, go back to the Bible. It tells you, it's in there. And I think going back to being the cradle perspective, I grew up Greek. So also part of the Greek culture is don't go to the doctor unless you really have to. And then you have these like crazy home remedies for like random things.
I'm going to tell you, the vast majority of those are good.
It's like,
I mean, my family is Italian, and we had the same kind of thing going on. I grew up Roman Catholic, so we had the old school Italian home remedies as well. I know all about it.
So we had those. I think kind of that has been part of my understanding of preventative health and how your health ties into your spirituality. And that's kind of how I grew up. Like my parents always said, don't go to the doctor unless you really have to. Let's try alternative methods. And then they also emphasized, because of course they were cradle Orthodox too, they also emphasized the whole church is your hospital. So we go, always turn back to your faith if you need it in your life, never lose faith. Always have it there, and it's just part of your life. And I think I said this on my podcast, but I always felt like I took my faith for granted at times, because I can't imagine like what it's like to not have God in my life. I don't know what it's like to go about my day without thinking of him or praying or reading the scriptures. Like, how does your life look? But that's how people are until they find Christianity. I think it's really helped me put it into perspective, especially having this podcast. I'm able to share those experiences, and maybe someone like me has felt that same way and wants to explore their faith further and kind of see how all this intertwines in your life, because it's all a big lifestyle is really what it comes down to.
So I completely agree, but the one caveat I'm going to add is that if you don't have Christ, you're going to feel it with something. And that's where it comes back to with the yoga, with the new age stuff, with the love of money, with whatever passion it is that's going to fill that God-sized hole in your heart. It's going to be something. And that's the scary part. You're not the only one, especially amongst the Greeks. There seems to be something. The Slavs, all the Russians and the Serbians and all of them, they're just beat into it real young. The Greek Americans, my godfather, Dino, and he gets a lot of shout outs on this show. Yeah, he's got to start paying me, I think, for these advertisements. But Dino's Greek, and same kind of thing, but he actually had a falling away period where he didn't really attend the church as much, and then his father had some health issues, big kind of thing. Unfortunately, he reposed, so may his memory be eternal, but that was the impetus that brought him back to the faith, and he's become much stronger in his faith since then. I know I mentioned it last week, we joke about it, how him and I are both black belts in Brazilian Jiu-Jitsu, but because I had to earn and really struggle to become Orthodox, he's like, I feel like I'm just a white belt, man. You're the black belt. Like, I'm not, but to that point there's something about that where it becomes so part of your life that it falls to the backside. And for those of us who were outside the faith, or at least, again, nominally Christian, Western Christians, we'll call. So we were in it, but not really. And yeah, there's other things that become part of it so much more because we don't have that praxis. We don't have that same ritual life. So other things are so easy to start to replace that. And you mentioned that it's just, what would my life look like without it? And I'll tell you, from the other side of the window, it's very easy. And it's scary because I never once didn't consider myself a Christian. I never once was like, no, I'm an atheist, I'm this, I'm that. I never was. But I definitely allowed other things to supersede and supplant my love for Christ, my love for God in my daily life. And Lord have mercy on me for that.
I can second you on that, Mike. It is really scary how it's so easy when you don't know to have that sort of double think where you could do one thing and at the same time say, oh yeah, but I'm Christian. It's like, are you sure? And then 10 years later and you think back, was I sure? I was, but now you see it for what it is. And you're like, Lord have mercy. How could that have been? But thank God, we're here. It is remarkable the way that the secular world makes it so easy to do that.
Yeah, and I think we're always continuously growing. I know I am. You grow up in the faith, and I'm always learning something new every single day, every single year. And I think when you grow up in the faith, it's about the traditions. That was my latest podcast episode. I talked about the traditions. So what I learned about in church was from things I looked forward to. So like the Diagnostics, bringing around the Epitaphial, the start of the liturgical year, at our parish, we would have all the ministries and Sunday school would start and all this. So you would look forward to these traditions. And that's kind of what marked aspects of learning what it meant to be Orthodox Christian and what it meant to be part of a community. But as I've gotten older, I've learned more about the theology and other types of traditions. So I think what's important is we have to continually learn, and that can help us to make sure we don't fall away, especially when life gets tough, because it's going to get tough. I mean, things are going to happen, and it's our job to make sure we turn to God instead of other things.
Absolutely. And so we've mentioned it a couple of times now, but we haven't really dove into it. So we've talked about a couple of different topics that you've covered, and we mentioned some of the guests you've had, but let's talk a little bit about your podcast. So Faithful Flourish Podcast. What was the impetus there, and what's your core theme? What are you going for?
Yeah, so I started this podcast in February. And my target audience is women, specifically women who are unmarried, young adult women, because I just wanted there to be a resource for women who weren't married, didn't have young children, because that's who I am. I don't have young children. I'm not married yet. So God willing, one day. But I just wanted to be in that space because when I was trying to find podcasts or materials, I couldn't find anything in that space. So I decided to fill it. It took me about a year. I got my blessing from my priest and put it all together. And really what I wanted it to be about was kind of flourishing, like growing in your faith, and then also femininity too, kind of learning what it means to be a godly woman and an Orthodox woman, and kind of just learning that side of our faith as well. And I give tips about how to be more feminine or live a softer life, and just kind of the Orthodox view on that, because it is biblical, and it is something that we should also take into consideration if we want to grow in our faith. We have to be in touch with that side of things. So I talk about that on my show, but really it's just a passion project of mine where I just want to share my faith and I just want to share my experiences that I've lived and hopefully connect with others who feel the same way and share one nugget of information. Maybe someone will find Orthodoxy, they'll find it helpful. So far, I've gotten some pretty good feedback from it. It's going really well, but I just really enjoy it and it's been a great project.
That's fantastic. And I think that the area that you're covering is so desperately needed. At least from my perspective, I might be in a sort of male echo chamber online, but I see a lot of male oriented content creation from Orthodox creators. And I think that you fill a very important niche for the women out there that need that sort of guidance. And there's, at least from what I see, small pool of people that are providing it. And I think that it's a great thing that you're there to do that for them. It's desperately needed.
Absolutely.
Yeah, and that was my goal because unfortunately there's a lot of women who fall away from the church. That's my experience, like at least growing up in the church. So a lot of women fall away for various reasons, and men do too. Once you kind of grow up in the church, you're done with the programs, your parents stop taking you.
Mhm.
Now it's up to you to figure out if your faith wants to be important in your life. And you kind of have that pivotal time where you decide that's what you want your future to be. For me, I was in college. So I decided in college, I'm going to make my faith part of my life. I want my faith to be my life. And you have to make that choice for yourself. But unfortunately, people, they replace it with something else, like we said. And especially for women, we're pulled in so many directions, especially modern women. We're told to have a big job, be independent, do all these things that aren't quote unquote traditional. But at the same time, if you want to live a fulfilling life and you are baptized in the Orthodox Christian Church, it is important to still maintain your faith in a way that is meaningful for you. And that's really my goal, is to help those women in that demographic to realize that they should hold on to their faith because it's so beautiful that you're baptized in this faith. And there's so much to be gained out of it.
Excellent. No, that's great. And like John said about finding a niche that very much need to be filled. That's how my wife found you, was she was looking for Orthodox women creating stuff that was going to be helpful in a daily life. Now, obviously, she is married and we have two beautiful girls, but it's an understanding of, hey, this is still the same path. It's just a matter of what stage are you on. So for us, you have a lot of really interesting ways of bringing, and because you grew up with it, you have an understanding of how women should be moving forward. So to that point, what does femininity mean to you from an Orthodox perspective?
I think femininity to me means just honoring how God created women. Simply being feminine or living a soft life, being just a feminine woman. It looks different for everyone. You don't have to be a woman who wears pink and dresses and loves flowers, like super girly girl, to be feminine. Women are feminine because of the way that we are different from men. We have different traits that allow us to complement men. So we're kind, we are helpful, we are emotionally strong. And these things are in the Bible, specifically Proverbs 31. And that is, in a nutshell, what it means. You're honoring how God created women and you're doing it in a way that's authentic to you, meaningful to you, and you are practicing that in your daily life. And therefore, you are just living your life in a way that is also part of your faith too, integrating that in your life. And I just want to share that as well and teach people how to do that.
Beautiful. And to that Proverbs 31 woman, it's funny. I don't think I've ever mentioned this on a show before, but when I proposed to my wife, I actually gave her a copy of the OSB and had highlighted a number of different verses and put them into a card. I had her open the card and she was looking through it. And so then she opened the Bible and was like, ah. And so she started reading through it. And a couple of them were from there. And there was other ones where it was like a good wife. And then she started putting two and two together. Like, oh, wait, he's on the ground. What's happening here?
Oh, that's sweet. I like that.
Especially because we were just in a random park in Kansas City. She was super confused for a minute. But to that point, it was, hey, this is what I'm looking for in a wife. Are you her? And it's kind of the way I went with that.
Yeah. And you saw that in her.
Yeah.
Yeah. Yeah. And I think that's important. Like, obviously, I'm not a Bible expert. I can't say quotes right now, but in the Bible, St. Paul talks about how husbands and wives should have their roles in relationships. I think that's really powerful to read those verses and read it as a way, not from I have to be submissive or in a negative way, basically, but view it in a way that's positive and in the lens of marriage is a sacrament in our church. And if we are living those roles and living out our femininity as God created women, then we're able to fulfill what that sacrament really means. And I'm not married, so I can't talk a lot about that, but I'm sure if you ask a priest or even someone who's been married in the Orthodox Church, they will tell you that what is said in the Bible and how they have their marriage with their spouse is how they are able to have such a beautiful relationship. So I think it's really important to understand that before you're married. And that's kind of how I try to give information and educate. That way you can kind of understand what it means and what to look for and how you can become transform, basically flourish into the type of woman you want to be, and that's godly, that's stated in the Bible, and can really help you in your future.
Might even say faithfully flourish into that. But to that point, we'll have to put a pin in that and make sure to ask Presbyterian Marina when we have her on.
Yes, ask her that because she probably has way more to say about that than I do.
Absolutely. Yeah, and we're tackling her mostly from the actual on-the-ground practical health, but we're going to definitely have some wider topics like that too. So yeah, we'll definitely put a pin for that one.
Yeah, perfect. Well, I'm glad to offer a little bit of insight, but
Absolutely.
Yeah, listen to her episode once it comes out. I know I will, because she
Absolutely.
is a really great guest and she has a lot of great insights.
Awesome.
Yeah, I just wanted to touch on something you brought up about how when we sort of live into our role as God made us and then come together, particularly in marriage, but even just in general interaction between men and women in society. But again, marriage in particular, we complement each other in such beautiful and unique ways. And there's so much about us that we don't know until we have those types of interactions, because there's things about men that women don't have, and there's things about women that men don't have, at least innately, but they can be built upon. For example, I know when I first met my wife, I realized later on I must have been the most emotionally unintelligent person alive. And just through living in relationship with her, and just because she's so much better at that than I am as a woman, she's so sensitive to other people's needs and so attuned to what they are feeling, and just through being with her and are interacting and caring for her and learning to appreciate and listen, it's like I don't think I'm that emotionally intelligent still, but there's an aspect of me now that's grown because I have my wife and we're one flesh. So that part of her that is so strong, I've been able to develop. And I'm sure it works vice versa in different ways. But there has to be this appreciation. This is where a lot of the other content online that isn't particularly Christian, that sort of wants to pit the sexes against each other, is just so wrong-headed. It breaks both sides down into something they were never meant to be.
Yeah, absolutely. And it's what situation, like you said, of all that other options out there. It's either you're going to be, as the interwebs say these days, you're either going to be the boss babe or you're going to be the Wicked Witch goddess, and you're going to reclaim your femininity this way. And it's a way to smash down the patriarchy, and you're going to become that full embodied woman through that. You're going to take it by force. Like you said, there's a complementary role, and that choosing violence and choosing force generally is not the innate feminine reaction. And so there really is something to that compliment being said. And you said before about submission, right? It's not about domination. It's about understanding that hierarchical order. Like we were talking with Father Jonathan Ivanov when we had him on, is that just because something is a hierarchy doesn't mean something is superior or better. It's just there's an ordering to things in life. And that's kind of the perspective we take of, hey, we need to have this complementary role. We need to work together. And as you said, you're sure that your wife has made your life better. I know Casey has done the same for me, where it's definitely men, we have that either fully or quasi-autistic brain of just that hyper-rationalistic idea, and emotionally aren't necessarily the strongest. And women help to bring that back into the fold and help to become one flesh, as you said.
I mean, talking about all of our recent discussion about things being so mechanistic. Men, we just have that proclivity, just that drive towards mechanism and process. But women are not like that. They're social, they're attuned to less material aspects of the relationship. And it's the stuff that honestly is of more substance.
And so to that point, you've talked about bringing this information and getting to women and helping show the path and how there's other ones that are going to direct them in the proper direction. So what role do you see for sisterhoods in the church that can help, and not only just sisterhoods, but even having that maternal role, having the women who have been there, who have done that, whether it be from the Presbyterian or the Matushka down to just the little old yaya over there in the corner, and all the to the women who are younger married age, to the unmarried, to the young adult ladies. We've talked about having the importance of brotherhood from the men's perspective, both in the church, on the mats, in the gym, etc., having these concentric circles. What do you see in terms of a sisterhood? What's the plan there?
Well, for my age, my demographic, single, unmarried women, there are a lot of us, like we do get together, and I have my friends, we all get together. I'm sure other people can relate, they have their single friends, but I do think, at least in my opinion, just like how I've grown up and what I've seen with the Orthodox Church, there are still many women who fall out of the church, and they unfortunately buy into the narrative of being the girl boss, of the feminism, like all of that. So I think it's really about wanting to step into those roles and wanting to live your life in a way that you want to honor those traditional feminine traits and tap into them when necessary. And I think we can look at our mothers, our grandmothers, godmothers, whoever's around us as mentors. And that can help us to, quote, heal, I guess you could say, from this old way of thinking. And the best way to do that is go to church and talk to people, because there's going to be people more than willing to help and help you understand. And even I talk to the young mothers. There's people my age who are married with kids. I'm going to talk to them just because they're not single. I talk to them and get insight of what it's like to be married and kind of live that life. How is it raising kids? And so I think it just helps to just be surrounded by people that you want to be like, and then that way you can step into that role. It's like easier for you when you're able to step into that. And I think that's kind of how women are doing it. It's just through the relationships we form. It's not necessarily, I haven't really seen like a lot of like groups, if that makes sense. There are some, but like not that I know of.
Right. Yeah, I know at my church there is a women's sisterhood. Can't think of what they call it. We have a men's brotherhood as well, and I know that at John's church he's very active in his men's brotherhood. But it's funny, at our church the women, they're a lot more organized and they do a lot better of a job than we do with the men's group. But it's something where I definitely think that needs to be a major focus, a major drive of having those relationships, having that where there's both that reciprocal of you're on the same level, but there's also that almost pedagogical that, hey, I've been through this. Let me help you to not make those same mistakes and stay on the right path here. And just, like you said, unlearning the old ways. And it's just so sad because those old ways are less than 100 years old. I mean, for the vast majority of life in the last 2,000 years, there's been dynamics that, again, there are ones where you're like, all right, well, maybe that was a little too far. Maybe we did some things that were a little squirrely here, but there's still a hierarchical nature to life. So while there's societal implications that might have been excessive, at the end of the day, there's still that reciprocal relationship that men and women are designed for. That it was not good for man to be alone, right? That was the first thing that God said was not good. It's not good for him to be alone. Everything else up until that point was good. So we need women. That is a major part of what we're doing here in guiding ourselves towards Christ. And they're able to fill roles that we cannot do by ourselves. And I say that with a caveat. The monks and the nuns are a different equation, but you know what I'm trying to say. For the vast majority of us who aren't going that particular vocation, that route, you need that dynamic and you need that partner. And so it's something that needs to be better understood. I definitely appreciate what you're trying to do for the young women out there.
Yeah, thank you. I mean, I do my best. It's still something that's kind of nerve-wracking, I guess you could say, like sharing opinions online. I've never been one to like share opinions and be vocal like that, but I think having my podcast has made me more confident to talk about my faith and just be able to share what I want others to know about it, maybe the insights I can give since growing up in the church, and then also just be that resource. So even if someone gets like one nugget of information or they hear one episode and they just really like it, then that's my goal. I just want them to learn something and be a resource because you never know where it will take them.
Absolutely. On the flip side of that, that goes to show you there the male-female dynamic, because I have the exact opposite problem. I have no problem just spitting out whatever the heck I think. I have to temper myself is the bigger problem, is that I have to find the humility and not always say what it is I'm thinking. And so John and I both come from fighting backgrounds, and so we're used to being the literal center of attention with the light shining down on us. And for us, that part's not the hard part. The hard part is making sure that what we're saying is A, in line with the church, and B, actually going to be edifying and beneficial to the people. And again, everything I've heard from you has been great. And from that female perspective, it's definitely needed.
Well, I appreciate that. I'm glad you're a fan and hope more fans can listen. Once they listen to this podcast, maybe they'll check out Faithful Flourish. So that's my goal.
Absolutely.
We'll certainly be sending people your way, 100%.
Absolutely. And there has been such an influx of male converts these days.
Yes.
As long as you're not a major creep, head on over to Katherine, hit her up, and actually be a good Orthodox man. We're trying to help develop good Orthodox men here.
Oh my goodness.
We did that to Gavin, is a single male. We threw him on the spot the same way, where it's like, young Orthodox ladies, go talk to Gavin. So we're going to do the same to you there.
Well, I think my podcast, I actually do have some male listeners. It's not all female. I do have a few, but I think it could be a way for men to kind of learn like the female perspective of things. So maybe if they're trying to figure out like, okay, what is the female view of this Orthodox topic, or what does the Orthodox Church view, then maybe I can teach them that.
Absolutely. And that's what we're looking to do on this women's health and femininity arc. Is the idea is, hey, we're still two dudes talking out into the internet. I can help from the hormonal perspective. I have training and understanding from a educational level and a clinical level, like working with women, but the rest of it, it's not where my brain's at and how my brain works. And I don't have that lived experience of, hey, this is what we're actually going through. So it's definitely something that we want our listeners, because we're not, while we have a larger male viewership, I think we're something like 35% female still. So we have a decent viewership in the female range. So we wanted to not leave them out.
Yeah, I think that's important.
Absolutely. And just as a reminder, John and I have a very particular set of skills. So, like I said, don't be creeps. Okay, guys? Without circling back too far, we have one last thought here. That actually kind of put a nice little tie on it, a little bow tie. During my one little rant earlier, mentioned how the church probably isn't doing enough from a public perspective for individuals. We definitely should be focusing on the preventative care. We definitely should be focusing on getting them that access to care. But how can we, as a church community, because you are in that field, what can we do to better facilitate access to care and just helping people from that end in terms of being the stewards that God has called us to be?
Yeah, that's a very interesting question. I haven't really thought of it from like a Christian perspective. I think from what I've seen, maybe help others in need. If you can donate money, like that could be a good way. Help people get to their doctor's appointments. If they need a ride, offer them a ride, or they need help picking up a prescription, pick up their prescription, help them go to the doctor, take them with you to make sure that the care they're getting is necessary and you get a second opinion, and just be there for people and take care of them, I think is really important. And when it comes to accessing healthcare, I just think it's really important to be able to be available for people. From what I've seen is a lot of people can't access healthcare because they don't have transportation, or they don't have the funds, or they don't have time to get there. So I think that could be a way, but unfortunately, I don't know if we can solve it as a whole, but as an individual, you can, if you see someone in need or see a friend in need or know someone who needs help, be there for them. In their time of need for healthcare. And then I think it'll be really rewarding and you'll be able to help them get access. But to solve the cost and being able to make that more affordable. I don't know. We can tackle that.
Right.
I don't think
So-
we're able to do that.
So, all right, since I know you're Greek, the Greeks, I know they have a large financial base. We need someone who's an angel investor to come up with an Orthodox Christian, like HSA, FSA kind of idea that's like both preventative and
Yes.
also post-care, and has a whole system that's an alternative medical system and insurance system. Get on it, guys. Somebody's out there listening has the funds to do it.
Yeah, well, the cultural Greek, it's say your prayers.
Right. That's
Say your
fair.
prayers, do your cross,
Drink your holy water.
sprinkle some
Yeah.
holy water on it. Hope you don't have to go to the doctor. That's the answer. But yes, ideally, if we had all the money, yes, of course we would do that. But
Yeah.
I wish, but that's just the world we live in.
Yeah, absolutely.
For now.
Yeah, for now.
For
Absolutely.
now. So I think we really touched on a lot of major questions. That was really
Yeah,
great.
a lot of good stuff.
Oh, yeah. So we've kept you here for around an hour right now at this point, and I think this is probably about a good place to close it. So this was awesome. I definitely think our listeners are going to really enjoy this episode. So Katherine, where can our listeners find you?
Yeah, so Faithful Flourish is on Spotify. And it's also on Apple and iHeartRadio. So check it out there. And then we are also on Instagram at Faithful Flourish Podcast. And I just post supplemental information on there. So you can give us a follow there. And then I'm an insurance broker, like I mentioned. So I'm able to help you find insurance if you need it. My website, KatherinePhillipsInsurance.com. You can go there, set an appointment with me, free consultation. And I help individuals, families, people Medicare 65 plus, self-employed people. So if you need insurance, let me know. I can help you and we can get you a solution that works. And that's really where you can find me. I'm also on LinkedIn if you're into LinkedIn. I know that's like a thing now. People really like LinkedIn. It's just Katherine Phillips on LinkedIn. So I'm sure they'll put it in the show notes.
Absolutely. Yeah, we'll drop it down there. And I'll be very honest, I do not like LinkedIn. It's just too sterile for me. Just no.
I know. I have it mostly for my insurance work, but yes, it is turning into like an adult. I don't know what it is.
I've been an adult for entirely too long at this point, and I trust me, I'm not a fan.
Yeah.
I'm not a fan.
People post like crazy stuff on there. I don't know. I just have it. I honestly, I didn't have social media, like Instagram. I didn't have it for 10 years. And then I got back on it for Faithful Flourish.
Yep.
And when I had it, they did not have reels. They didn't have stories. Like that was back when people would literally just post a picture and that was it. They wouldn't think too much about it. They didn't think too much about their grid or the colors or themes. So that's been a learning curve for me. I've been trying to figure out how to navigate Instagram and trial and error. So I'm doing my best. But other than that, I don't have social media other than like the Instagram and the LinkedIn.
Right. I mean, and so John doesn't have Instagram even. He's got a Telegram and carrier pigeons is literally the only way to get a hold of John.
Why they called me the disembodied voice of John.
That's right.
Our guests are probably the only people who ever get to see me embodied.
That's true. Right. So the guests, you're sworn to an NDA that he actually does exist, that he does have a body.
I'm a real person.
He is a real person, but they can co-sign for you. But to that point, this was awesome. I definitely appreciate you coming on. I think really you helped demonstrate how prevention, not just as a clinical term, but as a spiritual calling, and then how we need to focus on tending to the body that was given to us, that it is a temple of the Holy Spirit, and that we really shouldn't be focusing on just the vanity, that we need to cultivate virtue. And I think that's really what it means to flourish, right? Is honoring God with our body there.
Yeah, exactly. Your body, how you treat others. Exactly.
Yes, I certainly appreciated her challenge to us as a church community to not just outsource women's health to institutions that do not share our values, but to become the kind of place where women are supported, seen, and strengthened.
Exactly. The modern healthcare system is built around crisis, and too often it fails to see the body as a temple, and it allows that temple to be destroyed. The church, however, has always seen the body as sacred, especially the feminine body, created to bear life, to nurture, and to reflect the image of the Theotokos.
And that sets the stage perfectly for what's next. In our next episode, you'll hear from Gwyn Hoffmeister, a newly illumined Orthodox Christian, new mom, and former wanderer through the spiritual wilderness. Her story is raw, real, and deeply hopeful.
Absolutely. So whether you're a mom, a wife, a daughter, or someone just trying to better understand the deep connection between faith and health, stick with us. This arc is just getting started, and we are absolutely honored to walk this road with you.
Make sure to subscribe, share this episode with someone who needs it, and check out Katherine's Faithful Flourish podcast. You'll find the link in the show notes.
Absolutely. Until next time, stay rooted, stay humble, and keep seeking healing in Christ. God bless.
It is available on Spotify, Apple Music, and all of your other favorite listening locations. And you can also find us available on YouTube at Dr. Michael Christian, Rumble at Orthodox Health, and Substack at Orthodox Health Podcast. You can also follow us on social media for more insights, discussions, and behind-the-scenes content. Connect with us on Instagram at Orthodox Health or in our Telegram group at Orthodox Health Podcast and join the conversation. We'd love to hear your thoughts, answer your questions, and continue building this community together. And finally, if you're enjoying the show, leaving a quick review on your favorite podcast platform goes a long way in helping others discover Orthodox health. Until then, stay strong in faith, take care of your temple, and keep Christ at the center of your health journey. God bless.